Hello. In this video, I will analyze the knee surgery trolley problem that I posted a short video about last week. The link is in the description below. First, I want to say a few words about what trolley problems are and what I think they're trying to establish. A trolley problem is a thought experiment in philosophy. Its classic form is a runaway trolley is about to strike 5 people, but if you, a bystander, intervene and flip a switch, the trolley will be diverted onto a track where it will kill only 1 person. And the question is, should you throw the switch? Would you be justified in throwing the switch to directly kill 1 person rather than allow 5 people to be killed? There's a lot going on in trolley problems and different variations of them, but I think one of the main purposes of a trolley problem is not to get the right answer or even to provoke disagreement, but rather to bring to the surface our intuitions, our sort of gut check judgments about cases where sudden decision is required, like this. It brings them to the surface not so we can present them to other people or compare them, but so that we can do more philosophical work. We can analyze them. We can evaluate them. We can choose which intuitions we would wish to strengthen and which to suppress. We could try to connect them to a principle or a moral system which we would adopt to try to synthesize our ethical character into a whole. All of those are things we can do with our moral intuitions once we are aware of them, and I think a trolley problem can serve to help make us aware of what our snap judgment principles are, or at least seem to be. My series of realistic trolley problems is intended to help bring these intuitions to the surface in a more recognizable environment. One of the criticisms of trolley problems is that they seem highly artificial, right? Nobody is ever the sole bystander able to throw a switch. The realistic scenarios here allow us to imagine a protagonist like us, or let's say a scenario in which we easily could imagine ourselves having to make a sudden decision like this. In fact, some of these problems are drawn from history. People have had to make decisions precisely like this. The one I'll discuss today goes like this. You are working at a hospital where the financial system is such that the hospital only gets paid for knee surgeries if it performs 50 or more in a calendar year. You can't change the payment system. That is fixed and beyond your control, but you do work within it. It's December, and you've only done 48 knee surgeries. And the question is, should you be willing to do 2 unnecessary surgeries, do knee surgeries on 2 patients for whom surgery is not the best option in your medical judgment, in order to guarantee the hospital payment for all the work that it's already done? And in the scenario imagined, the hospital itself is in some financial distress, and losing this source of income might push it over the edge into insolvency, closing it down and depriving people in the area of access to medical care. Again, see the link in the description below for the full trolley problem. So, like most trolley problems, this one presents us with a choice between a principle or rule, which we would follow in ordinary times, and a certain utility or avoidance of disutility that might be achieved by disregarding the rule, by breaking with the principle in this one case. So what is the principle and what are the utilities involved? Well, here's where I want to do a little bit of analysis. So here's a list of some of the materials that I think are, some of the factors that I think are relevant to the decision that we would make. Okay. By far, most of the commenters right now on that video have taken the no, it's not proper, not appropriate to do the knee surgery. So let me show you the chart here that I've typed up just with a few minutes of thought. Should we do unnecessary knee surgery? The question here is whether to act or whether to refrain from acting. And on the side of refraining, we have a principle. It seems the principle here I could just describe loosely as professional obligation. A doctor has an obligation as a doctor to himself, to society, to the sort of core of doctors, and also an obligation to the patient to be a doctor. And to be a doctor means always to take medical decisions and recommendations and actions which are in support of the patient's health, not for any financial motive that's separate from that. That seems to be a very strong factor on one side. In fact, one might even argue that that principle is enough to decide the question. It doesn't matter what else is on the chart. But thinking for a little while, I put a few more things on the Refrain side. I said, there's also the question, sort of in general, of patients' trust in their physician as a sort of cultural factor. Patients trust their doctors to do what is right for the patient and not to do more than that, not to do things that enrich the doctors or support the financial health of the medical institution of which they're a part if it conflicts with what's best for the patient. So there's a general question beyond just mere professional obligation, duty, Hippocratic oath. There's the broader question of patients trust their doctors, and this acting in a way so as to do these surgeries abuses that trust. There's also, of course, the question of the law. It is certainly, in Germany and elsewhere, against the law for doctors to do unnecessary surgery that they know to be unnecessary. There's the harm and the risk of actually doing the surgery to the two patients. Each of them will have a greater recovery time, will involve invasive procedures in their bodies, which are not justified by medicine. There's the betrayal of trust, the need to tell a very specific, concrete lie to, at the very least, the two patients you are deceiving. So I'll put that sort of, in addition to, that's the sort of concrete case of which the abuse of patient trust is the general case. There's also the question of whether there are other solutions, and it doesn't take too much thought to imagine that one might say, perhaps we can recruit two people from outside the local area to come and get their knee surgeries done here. I might go to two people in Munich and say, would you travel an hour out into the country to come to my hospital for your knee surgery? I'll pay your travel expenses and maybe a couple of days recovery time in the mountains as well. There might be other solutions beyond the one that's proposed here, this fairly radical violation of a professional obligation in principle for these two patients. What can I say on the act side? Now, here's where I would find the utility that's to be balanced against the principle. If we violate the principle, we can achieve some good. What's the good that's promised in this hypothetical thought experiment? Well, one is the preservation of access to care, to medical care, for thousands of people in this rural area where the hospital is located. I might specify it's not just medical care, period. It's fast emergency medical care, which is quite important, but we do face the prospect that even if my hospital, my clinic closes, people will still have access to care. They may have to drive an hour to get it. There is, however, the prospect mentioned in the video that there will be additional deaths in the future if this hospital closes because of lack of money, that people who would have survived if they had a 10-minute trip to a hospital will die on the 60-minute trip into the hospital in the city. And that would be a foreseeable consequence of my refusing to do these two additional surgeries. So how do we balance this out? How do we evaluate this? I think looking at all these factors here, the one that seems strongest is, of course, the first one I've put on the right side. The professional obligation of a doctor is a powerful principle, and it seems that it would require an immensely powerful utility on the opposite side in order to even begin to justify its violation. In fact, some people would argue it can never be justified. I'll return to that idea in a moment. What we have on the left column are some utilities which it would be nice to have, and maybe even quite important. In fact, preventing additional deaths in the future is certainly good. But they have a couple of characteristics that seem to me to place them in a weaker position relative to the very strong principle that doctors should always act in their patient's best interest. The first is that there's simply not enough quantity of utility, benefit, to be gained by violating the principle. Access to care is good, access to fast emergency care is good, but it seems like it's not of a magnitude sufficient to justify that I would want to justify a potential violation of a principle as important as the professional obligation to patients. I'll say also it's not definite enough. It's not for certain that the hospital will close. And if it does, I should also say it's not certain that my particular failure to bring in sufficient income in the knee surgery unit was the deciding factor in causing it to close, which indicates that I may not bear full culpability for whatever the foreseeable consequences of its closure would be. And then I'll say as well, it seems to me that the problems that come up with failing to act on the left column are not immediate enough. There are benefits to be had, there are losses to be had, but the idea that someone at some point in the future, some unknown people, may die as a result of not having access to fast medical care seems kind of weak when placed up against the fact that I have to lie to and violate the bodies of and the trust of these two very specific patients in front of me right now. So it seems to me that if this argument were to work at all as in the case of acting, doing the surgeries, I would want to find something much more powerful on the left side of this chart than I actually do find. So that's my sort of simple analysis of what I see to be the factors involved and the weight that we would assign to them. Those are the kind of things that we might debate if we were to go further through this problem or go over it again from a different perspective. So a final word about trolley problems in general. One of the things that comes up that in analyzing a problem like this is, what does it mean to have a principle, right? Is my principle that doctors must always act in the best medical interest of their patients? Well, if it's a principle, it seems like it ought to never be up for negotiation, for being violated under any circumstances. That even to treat it as the kind of thing that might be balanced against things in the left column is to miss the point of having a principle. Is it just the case that my principle that doctors should act in the best interest of their patients, is that simply a very high utility good that I attach a lot of value to, which would need to be matched by an even greater value benefit to be had? You know, Hitler will take over the world unless I do these surgeries. Perhaps in that case, I would consider doing it. So maybe the question I'll leave us with, that we'll talk about perhaps if we analyze more of these, is once I bring a principle into play, isn't that sufficient to make the decision? Isn't all the rest of it simply discussing why it is that the utility being brought up is not sufficient to overwhelm the principle? Or perhaps I'll ask the converse of that. If I do think that utility could override the principle in question, is it simply the case that it never was a principle in the first place? That that's not what I'm dealing with when I'm going through my sort of unexamined moral reasoning about this particular problem. So that's my analysis of the knee surgery realistic trolley problem. I hope you found it illuminating. Thanks for watching today. Goodbye.